Ever wondered why sodium is such a crucial part of our body's functioning? Or what could possibly go wrong if sodium levels become imbalanced? Let's kick things off by shedding some light on the importance of sodium. Sodium, a tiny mineral, plays a substantial role in maintaining the balance of fluids in our body. This balance is not just a trivial matter of hydration, but it's also pivotal in ensuring that our cells function correctly, our nerves transmit signals efficiently, and our muscles contract smoothly. Now imagine if this balance is disturbed. What if the sodium levels in our body rise too high, a condition known as hypernatremia, or drop too low, termed hyponatremia? Well, that's when things start to get tricky and we begin to enter the realm of sodium disorders. Sodium disorders are a group of conditions that occur when there's an imbalance in the sodium levels within our bodies. These disorders can be quite complex and can manifest in a variety of ways, each with its own unique set of causes, symptoms, and potential treatments. For instance, the causes of sodium disorders can range from simple factors such as diet and water intake, to more complex issues like kidney or heart disease. The symptoms too can be as mild as feeling a bit thirsty or tired, to more severe ones like seizures or coma. And when it comes to treatments, they can be as straightforward as adjusting your diet or fluid intake, or might require more intensive medical intervention. But don't worry, it's not as daunting as it sounds. In fact, understanding these disorders can be quite intriguing. It's a journey that takes us deep into the inner workings of our body, revealing the incredible balance and precision with which it operates. So, are you ready to dive in? To explore the intricacies of sodium disorders, to understand their causes, to recognize their symptoms, and to learn about their treatments. Stay with us as we delve deeper into the fascinating world of sodium disorders and how they affect our bodies. So, what could possibly cause your sodium levels to go haywire? Great question. Sodium disorders can be triggered by a myriad of factors. Let's delve into the most common ones. First on the list is dehydration. When we lose more water than we take in, our bodies try to compensate by holding on to sodium. This can lead to hypernatremia, a condition characterized by high sodium levels. Conversely, overhydration, or taking in too much water, dilutes the sodium in our bodies, which can result in hyponatremia, or low sodium levels. Moving on, let's talk about certain medications. Some drugs, particularly diuretics and certain antidepressants, can affect how our kidneys handle sodium. Diuretics increase urination and can cause you to lose too much sodium, while some antidepressants may lead to inappropriate secretion of the hormone that regulates water levels in your body, causing sodium levels to drop. Next up is heart failure. When the heart doesn't pump blood as efficiently as it should, it can lead to fluid buildup in the body. This fluid overload can dilute the sodium in your body, causing hyponatremia. Similarly, liver disease can contribute to sodium disorders. Advanced liver disease, such as cirrhosis, can affect the body's ability to regulate sodium and cause fluid to accumulate in the abdomen, leading to dilutional hyponatremia. Kidney problems also play a significant role in sodium disorders. Our kidneys are the primary regulators of our body's sodium. Conditions that affect kidney function, like kidney failure or certain types of kidney diseases, can impair the kidney's ability to regulate sodium levels. Last, but certainly not least, hormonal changes can throw our sodium levels off balance. The body's balance of sodium is closely tied to the balance of hormones, particularly aldosterone and vasopressin. Conditions that disrupt these hormones, like Addison's disease or syndrome of inappropriate antidiuretic hormone, SIADH, can lead to sodium disorders. In Addison's disease, the adrenal glands don't produce enough aldosterone, which helps regulate sodium levels. This can result in too much sodium being lost in the urine, leading to low sodium levels. On the other hand, in CADH, there's an excessive amount of antidiuretic hormone in the body, which causes the body to retain too much water and subsequently dilute the sodium in the bloodstream. As we can see, a variety of factors can disrupt our sodium balance, leading to potential health issues. Whether it's dehydration, medication side effects, heart failure, liver disease, kidney problems, or hormonal changes, it's clear that maintaining a healthy sodium balance is a complex process. And with that, we've covered the main causes of sodium disorders. Now that we know what can cause sodium disorders, how would you recognize if you or someone else is experiencing one? The symptoms of sodium disorders can be as subtle as a mild headache or as severe as a life-threatening coma. The severity and type of symptoms depend largely on whether the sodium levels are too high or too low. We call the condition of low sodium levels hyponatremia, and high sodium levels hypernatremia. Let's start with hyponatremia. If sodium levels drop gradually, symptoms might be hard to spot. They can be mild and often mistaken for conditions like dehydration or fatigue. These symptoms might include nausea, headache, muscle weakness, and general malaise. But as the sodium levels continue to drop, more severe symptoms can develop. These can include confusion, hallucinations, decreased consciousness, and in severe cases, seizures and coma. Now, it's important to remember that these symptoms don't necessarily mean you have hyponatremia. They're common in many other conditions as well. But if you're experiencing these symptoms, and there's a chance you've been consuming too much water, for instance, during a marathon, or if you've been taking certain medications, it's worth getting checked out. On the other side of the spectrum, we have hypernatremia, or high sodium levels. Unlike hyponatremia, the symptoms of hypernatremia are often more apparent and can occur more rapidly. Common symptoms include extreme thirst, a dry mouth, swollen tongue, fatigue, irritability, and restlessness. As the condition worsens, the symptoms escalate to confusion, muscle twitching or spasms, seizures, and again in severe cases, coma. If you're experiencing these symptoms, it's important to seek medical attention immediately. Now let's take a moment to talk about the brain. It's particularly sensitive to changes in sodium levels. When sodium levels change too quickly, it can cause the brain to swell or shrink, leading to potentially serious neurological symptoms. These range from headache and nausea to seizures and loss of consciousness. In both hyponatremia and hypernatremia, the key is to recognize the symptoms early on. Remember, these disorders can be life-threatening if not treated promptly. If you or someone else is experiencing these symptoms, it's crucial to seek medical attention. In conclusion, sodium disorders can present with a variety of symptoms ranging from mild to severe. It's not always easy to spot, but being aware of these symptoms can help you recognize when something might be wrong. Symptoms of hyponatremia and hypernatremia can overlap, but they often include nausea, headache, confusion, and in severe cases, seizures and coma. Recognizing these symptoms can be the key to timely intervention and treatment, so listen to your body and take action if necessary. After all, prevention is better than cure, and early detection can make all the difference. The symptoms sound daunting, don't they? But don't worry, there are treatment options available. When it comes to treating sodium disorders, the first and foremost step is to identify and manage the underlying cause. It's like fixing a leaky faucet. If you only mop up the water without addressing the source of the leak, you'll just keep mopping forever. Similarly, if a sodium disorder is due to a medical condition like kidney disease or heart failure, treating that condition is paramount to restoring sodium balance. Now let's talk about fluid management. If you're dealing with a high sodium level or hypernatremia, your body is parched, it's thirsty for water. So, the treatment often involves increasing fluid intake or intravenous fluid administration to restore balance. On the flip side, if you're grappling with a low sodium level or hyponatremia, it's a different ballgame altogether. You've got too much water diluting your sodium, and treatment may involve restricting fluid intake to allow sodium levels to rise. Medication also plays a significant role in managing sodium disorders. In some cases, diuretics, which are often called water pills, are employed to make you urinate more. This helps your body get rid of excess sodium and water. However, for some people the problem isn't too much sodium, but rather, not enough. In such instances, a doctor may prescribe medication to increase the amount of sodium in your body. Now, you might be wondering, what if my sodium disorder is severe? Well, in severe cases, hospitalization may be necessary. This is particularly true if the individual is experiencing severe symptoms like seizures or coma. In the hospital, doctors can closely monitor sodium levels and adjust treatment as needed, often using intravenous fluids or medication. But let's not forget about lifestyle modifications. Yes, they can be as effective as medication in managing sodium disorders. For example, if a high-sodium diet is the culprit, reducing the intake of high-sodium foods can help. Think canned soups, processed meats, and even some breads. And if you're dealing with low sodium levels, consuming a diet rich in sodium may help. But remember, always consult with your healthcare provider before making any dietary changes. The road to recovery from a sodium disorder can sometimes be long and winding. It requires patience, persistence, and most importantly, adherence to the treatment plan. It's not always easy, but it's worth it. After all, maintaining a balanced level of sodium in your body is crucial for your overall health and well-being. So there you have it. From identifying and treating underlying causes, to fluid management, medication, hospitalization, and even lifestyle modifications, there are various ways to treat sodium disorders. And while the journey may seem challenging, remember that with the right treatment and care, you can restore balance to your body. Remember, early detection and appropriate treatment can manage sodium disorders effectively. So, what have we learned about sodium disorders today? We've journeyed through the complexities of sodium disorders, and it's clear that sodium is not just another element on the periodic table. It's a vital mineral that plays a crucial role in our body, helping to maintain fluid balance, transmit nerve impulses, and enable muscle contractions. Inadequate or excessive sodium levels, however, can lead to serious health issues. We've delved into the causes of sodium disorders, which range from underlying medical conditions to dietary factors. Disorders such as hyponatremia, which occurs when sodium levels drop too low, can be caused by conditions like kidney disease, heart failure, or even excessive water intake. On the other hand, hypernatremia, which is characterized by too much sodium, can result from dehydration, certain medications, or a diet high in sodium. The symptoms of these disorders are often subtle and can be easily overlooked. We learned that they can range from mild issues like fatigue and headache, to severe problems like seizures, coma, and even death in extreme cases. This underlines the importance of regular checkups and blood tests in detecting any potential sodium imbalances early. But it's not all doom and gloom. We also discussed the various treatments available for sodium disorders. These range from lifestyle changes and dietary modifications to medical interventions. For instance, hyponatremia might be addressed by reducing fluid intake and adjusting medications, while hypernatremia may require increased water consumption, dietary changes, or in severe cases, intravenous fluids. Indeed, the treatment largely depends on the underlying cause. So it's not just about treating the symptoms but also addressing the root cause to prevent future problems. It's a holistic approach that requires medical guidance and sometimes lifestyle changes. And speaking of lifestyle changes, let's not forget the importance of prevention. Maintaining a healthy lifestyle can go a long way in preventing sodium disorders. A diet balanced in sodium, regular exercise, and staying hydrated, but not excessively so, are key to maintaining healthy sodium levels. It's about finding balance, not too much, not too little, just right. In conclusion, sodium disorders are complex but manageable with the right knowledge and care. It's essential to be aware of the causes, symptoms, and treatments, but also remember the importance of prevention. Regular checkups, a healthy lifestyle, and maintaining a balance in sodium consumption can help keep these disorders at bay. Ultimately, the power to stay healthy is within our grasp. Knowledge is power, and understanding our bodies and how they work is the first step towards better health. Remember, your health is in your hands. Stay informed, stay healthy. Until next time, goodbye and take care.